Welcome to ComSpark. I'm Lauren Worley, and today I have JD Whitlock of Dayton Children's. Hi JD, how are you doing today?
Pleasure being here.
Thanks for joining us. Just a few questions for you. First one, what emerging technologies are you most excited about, and how do you see them affecting Dayton Children's?
So one hot technology that's getting a lot of press these days is artificial intelligence, as it is in all industries, not just healthcare. Healthcare is a little different in that if you do things wrong, you can kill people. So we take a little more conservative approach, and we talk about things like when we're using predictive analytics and artificial intelligence, how do we intelligently integrate it into clinical workflow so that our doctors and nurses and other caregivers can use that technology the right way in healthcare.
And kind of along those lines, what's Dayton Children's doing right now to differentiate yourself from some of the other local hospitals?
Sure. So we, at Dayton Children's, we are 1 hour away from two of the top 10 children's hospitals in the country, between Nationwide and Cincinnati Children's. And so we are not going to differentiate ourselves from being the top ranked in the U.S. News and World Report. What we try to differentiate ourselves around is patient experience. So how can we deliver top quality care in the local community with the customer experience that our main customers, who of course are mostly millennial parents of our patients, have come to expect in other industries. So how do we make the entire experience from getting a referral and getting an appointment and seeing our providers and follow-up and billing, how do we make all of that as pleasurable experience as it can possibly be, even though sometimes the getting your kid treated for something is not pleasurable.
Absolutely. On a little bit more of a selfish note, what do you believe has been your biggest contribution to the hospital?
So I've been at Dayton Children's for a little over 18 months now. And so one thing that we've come a long way on is cybersecurity, which is not anything you want to brag too much about. Of course, that just attracts the hackers. But we have done a lot of things differently in the last 18 months that have put us in a better place for cybersecurity.
So now that you're 18 months in, what's your biggest influencer in making and prioritizing your decisions?
Sure. So we have a series of governance committees where we get the right people in the room, not the IT people, also the IT people, but our clinical and business leaders, and we talk about how we're going to spend our limited resources on technology in the smartest possible way. So we do that with our executives if we're talking about spending significant money on a new software, and then we do it with individual doctors, nurses, managers of clinics when we're talking about doing smaller projects where we, for example, configuring our Epic electronic health record and how we coordinate our teams to deliver the biggest bang for the buck with their time and our money.
That sounds great. Well, thanks for sitting down with me today. For more information, you can visit comspark.tech.